Are you struggling with chronic health issues? Maybe you've seen multiple doctors and not sure you're making any progress with them and whether or not they're understanding what's going on with your health and your symptoms. My name is Dr. Taranella, and in this video, we're going to look at ways that you can help your doctor and help yourself understand a little bit deeper at what some of those symptoms might be telling you, so you can help your doctor get a better understanding of what's going on with you, and by default, help yourself. So if you like this kind of information on deepening your understanding of health, nutrition, just trying to get a better understanding of what's going on with your body, click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer, the information in this video is for informational purposes only. It's not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deeper your understanding of your own health and treatment success. If medical attention is needed, don't delay in seeking that attention. Let's look at understanding the language of the body and your symptoms. So in this video, we're going to talk about the language of the body and understanding your symptoms. So the language of your body is basically the symptoms and signals that your body conveys to you on a regular basis. It can be a little bit tricky, though, interpreting what they mean depending on what kind of symptom or problem is there. At the heart of this topic, though, is really getting an accurate and solid understanding of what's occurring underneath those symptoms. When you can't figure it out or it seems concerning, that's typically when you go see a doctor, and they can help you pinpoint or narrow down where that problem might be coming from. And it's with that more precise, accurate understanding of where the problem is coming from where you get effective treatment. Not all symptoms and health problems require such a careful look at this idea of understanding your symptoms and understanding language of the body. For instance, some things we can understand very simply by just doing a physical exam or a simple blood test. However, if you're struggling with chronic health issues, you may benefit from taking a deeper look at your symptoms. So we all may know this, but symptoms are by nature very subjective. And because of this, there is sometimes a communication problem. You say one thing and you mean one thing, but that's not necessarily getting across to the doctor or the other person because you may have different understandings of what that word or location refers to. For instance, a lot of times patients say, I have hip pain. And then when we get a little further along in the conversation, I say, where is your hip pain? Sometimes they may point to their back here. Sometimes they may point in the front. Sometimes they may point on the side. And so something as simple as hip pain can be misconstrued if you don't really ask that simple question. Where does it actually hurt? Can you point to it? This is a simple example and maybe an obvious one, but you'd be surprised how therapies and treatments get prescribed without really understanding some basic information on that symptom. And this is where you come in, because symptoms are subjective. Only you can really feel and get that nuanced understanding to describe what's going on. So let me give you another example. If you say you have fatigue, we can reasonably assume that you're lacking energy at some point during the day, but we don't know what time of day it happens. We don't know what it's associated with in terms of maybe it's after activity, maybe it's after work, maybe it's first thing in the morning, maybe it's after you eat. We don't know a whole host of things about that fatigue. We don't know if you are sleeping fine. We don't know if you sleep all night and during the day. We don't know if your fatigue comes and goes. Some days you have it, some days you don't. We don't know if you also have body aches or feel like you have the flu. We don't know an endless number of questions that help us understand what's really going on behind that fatigue, help us narrow down where that fatigue might be coming from. And this is where we have to go deeper to find the obvious. As we describe the symptoms and health problems in more and more detail, sometimes it just really becomes very obvious what the problem actually is. So if you are not able to or don't look carefully at your symptoms and really try and experience them and then reinterpret them in a way that makes sense to your doctor or whoever's trying to help you, you may miss some very obvious things about ultimately helping yourself. And I mention this because it's quite common that these sort of things come up when I'm talking with patients and trying to help them understand what's going on with their body and diagnose and treat them. Oftentimes, as we get further and further into the questioning, the reason that problem is present becomes more and more obvious. And so this is just to emphasize that you are an active participant in your health in discovering new connections and understanding what's going on. And the more chronic and ongoing your health issues are, the more you have to look at this in a deeper and more careful way. And you may think, well, I'm not really a doctor. I don't really understand this stuff. Really, you just have to be curious about what's going on in your body. It doesn't take much. You just have to be curious about things and then track it on a consistent basis. So then you can reflect on that tracking and understand what's going on with that particular symptom or health problem. In the description, you can find a link to a journal, a symptom tracker journal that I laid out as a way to help people track their symptoms and track what's going on with their body so they can help themselves and also help their doctors treat them better by narrowing down where those problems might be coming from. So the symptoms are the language of the body, and it's up to you and, of course, your healthcare providers to interpret that body language. So now that you get the idea of understanding your symptoms as a language that the body produces, in the next video on this topic, we're going to look at the role of the doctor and how the doctor uses detailed descriptions to interpret and overlay those onto different areas of the body, ultimately give you a better treatment. All right, that should give you a better understanding of the language of your body and understanding your symptoms. I'll be curious to hear if you've had similar experiences where you looked a little bit deeper at the symptoms and what was going on in your body and came to a obvious conclusion about what the cause or underlying problem was. Okay, thanks again for watching. We'll see you next time.